Jumping to Friday, you guys will be talking about bladder cancer updates. So talk me through some of the cancer things you're excited about.
So there's a lot to be excited in terms of bladder cancer. I feel like bladder cancer has been having a moment for the
Yes,
last few
it
years.
really has. It's on the rise.
Yes, and so we're going to be hearing additional efficacy outcomes, including overall survival data for CheckMate 274. As a reminder, that's adjuvant nivolumab for patients with muscle-invasive bladder cancer. And having a significant overall survival benefit in addition to the PFS data is always the question when it comes to having that risk-benefit discussion for adjuvant therapy in this setting. And there was some data presented at EAU last year, but we're going to have additional data in terms of OS for this adjuvant trial. And this will definitely help us having these discussions with patients. We also had the groundbreaking NIAGRA trial presented at ESMO that we talked about just a few months ago.
Yeah.
As a reminder, that's neoadjuvant Gemcis durva for muscle-invasive bladder cancer. And we're going to hear more efficacy and safety outcomes, as well as an exploratory analysis of the impact of pathological CR in this patient population. And then following the lead of NIAGRA, we're also going to be hearing about the safety and efficacy of neoadjuvant immunotherapy in upper tract urothelial carcinoma with either Gemcis or Gemcarbo with durvalumab. And so as of right now for upper tract, there was a phase 2 trial looking at neoadjuvant Gemcis, and then we've had the POUT data out in terms of adjuvant Gem platinum, so either Gemcis or Gemcarbo. And so it will be exciting to see, the use of immunotherapy in this space as well.
Yeah, that's awesome. And so I know since the EV302 trial just over 2 years ago, there's a lot of enthusiasm surrounding these antibody drug conjugates in bladder cancer. Of course, we just talked about they're having their moment. And so what else is exciting in this realm?
So there actually will be an update on the OS analysis from EV302. As a reminder, this looked at EV Pembro versus platinum chemo, and this has been our new standard of care for first-line metastatic urothelial carcinoma for the last almost 2 years now. Or I guess just over a year. And as far as other antibody drug conjugates go, there's a lot of interest in disitamab vedotin, which is a HER2 antibody drug conjugate in muscle-invasive bladder cancer with immunotherapy. So we will hear results for perioperative therapy from a phase 2 trial called RC48. Right now, we have approvals for a different HER2 antibody drug conjugate, TDXD, from patients with metastatic urothelial carcinoma who have IHC of 3+. And then there's also going to be a phase 1 study presented looking at a novel Nectin-4 targeted antibody drug conjugate, which is the same target as enfortumab, as well as another TROP2 antibody drug conjugate, tatopotamab deruxtecan.
They always just roll off the tongue.
I know. So again, that's the same target as sacituzumab, which we had data from TROPiCS-04 in the last few months. And so the data from this tatopotamab is from the Tropion Pan-Tumor-01 study. So it'll be interesting to hear about that as well.
Yeah, that's awesome. And so I know we mentioned circulating tumor DNA already when we were talking about prostate cancer. And so again, this is such a hot topic in almost all solid tumors. What is going to be presented regarding circulating tumor DNA in bladder cancer?
Yes, I'm very excited for a session entitled Panning for Gold, the Role of ctDNA as a Biomarker for Bladder Cancer. So how can it be used to improve clinical staging, both for upper tract and for lower tract bladder cancer? How can it help us with decisions for perioperative management? It can also help in terms of decisions for bladder preservation. And so separately, there's also going to be a phase 2 trial presented looking at risk-enabled therapy after neoadjuvant chemoimmunotherapy for muscle-invasive bladder cancer called the RETAIN-2 trial. And so we'll be able to hopefully identify how to select patients that can actually benefit from bladder preservation options following systemic therapy alone. And then the last thing that I'm excited about when it comes to bladder cancer is a novel FGFR3 inhibitor from a phase 1 study called Forager 3.